Health Minister Phaahla and his provincial counterpart in Gauteng are providing an update on vaccination and general dysfunction in the local health sector. Heidi Jokos is there at that briefing and standing by for us. Heidi, thanks for being there. What have you heard so far?
This is going to be a very important briefing, Annika, with regards to where the health sector is, especially here in Gauteng. One must remember that there were huge issues when Charlotte Maxeke went up in flames, and we were told that repairs would take a while, and the National Department of Health was brought in to facilitate this process, as it was a very complicated one and a very expensive one. But we do know that the Health Minister, Dr. Phaahla, together with the MEC and other government officials, did a walkabout on Monday to assess the readiness and how far repairs are at Charlotte Maxeke. And to our surprise, I actually don't think it's much of a surprise, because we are seeing this time and time again. There seems to have been sabotage with regards to the emergency units. Very expensive equipment had been stolen, damaged, and this is going to set back the time frame in terms of when the hospital will be able to open up. What's also important to highlight here is that the Health Minister did indicate on Monday that the Department of Infrastructure here in the province, in Gauteng, has been asked to step aside because they had not been progressing fast enough and to the level of satisfaction that the Department of Health would have liked to in terms of the repairs at the hospital. Because this hospital has not been able to operate at 100% capacity, it's put immense pressure on other hospitals such as Chris Hani Baragwanath Hospital, Helen Joseph Hospital, because this hospital has not been able to operate at full capacity. So I think the Department of Health and the Department of Health in the province has a lot to answer to, Annika, because you have the most vulnerable people in the in our society here in the province needing healthcare services and now being turned away because of delay after delay, sabotage, possible corruption in terms of the repairs here because of that fire that took place. So we're going to hear an update with regards to the healthcare facilities here in the province, but also I think further developments when it comes to Charlotte Maxeke.
Yeah, and we desperately need those, because we've heard doctors just saying from other hospitals, as you correctly said, that they're just not dealing well with overflow, especially in accident and emergency and in the psychiatric wards. Anything expected about the vaccination drive, or do you get the sense that since restrictions have been dropped again, there isn't as much of a push towards COVID and vaccines?
We do know that the Health Minister will definitely give some kind of updates with regards to COVID-19, especially after the President made the announcement of easing restrictions such as no more mask wearing outdoors and a number of other restrictions such as providing proof of vaccination, especially for big events and where events need to have over 50% or 50% capacity at large events. So we do know that there will be a discussion and a further update with regards to that. But Annika, what is interesting, and I don't want to sound alarmist, but I think it is important to highlight, is that yesterday we had over 2,000 new COVID-19 infections. The day before we had 1,000. It's doubled in one day. And this could just mean that we are doing more testing, but it's going to be important to ask the Health Minister if there is some kind of concern with regards to, now that restrictions have been eased, is he worried this is going to push infection rates up, or is there not much of a concern because we are vaccinating, and that seems to be an important element in fighting this pandemic. But I do think government has been very clear with regards to, yes, there's not as many infections, and it seems as though we don't have a worrying variant at this stage, but we need to vaccinate. And the President also made mention of the fact that what we need to do is still continue to vaccinate, especially the younger population, which we are seeing numbers very low.
Thanks, Heidi. We look forward to chatting to you a little bit later once that briefing's been done. It sounds like it's fairly crucial involving the health sector. Thank you.